Barriers in seeking psychological help. Public perception in Pakistan. Health-related stigma exists cross-culturally. Research has confirmed that mental illnesses are more stigmatized as compared to physical illnesses. People having severe mental disorders such as schizophrenia are more stigmatized as compared with people with less severe disorders such as depression and eating disorders. Seeking professional psychological help has been considered a source of fear itself and can be conceptualized as an approach avoidance conflict. It remains the last option to overcome psychological problems. Only 1/3 of individuals who need professional psychological help actually receive it. People tend to avoid professional psychological services and try to receive help from their family and friends. Several studies have attempted to explore the decisions to seek psychological help and suggested several personal and socio-cultural factors involved. These factors include gender, emotional openness, self-construal, self-concealment, self-disclosure, prior help-seeking experience, treatment fearfulness, public stigma, opinions about mental illness, feelings of distress, coping, past counseling experience, access to care, cultural factors, social support, and insurance coverage. Barriers in seeking psychological help have been studied widely in different cultures. The researchers have proposed several reasons why people do not avail psychological services the way they are expected to. Intentions play the key role in deciding and performing behavior and are influenced by attitudes, subjective norms, and perceived behavioral control. Attitudes towards seeking psychological help are the best predictors of seeking actual psychological help. Studies conducted in different countries have revealed that the societies in which attitudes towards seeking psychological help are negative have decreased utilization of mental health services. People who are willing to disclose their personal information are more inclined to seek professional psychological help. Mostly, people feel shame in discussing their painful emotions and therefore avoid seeking professional psychological help. This also reflects their low self-esteem, low self-respect, and low self-efficacy. Lack of knowledge about mental health-related problems or poor mental health literacy is an important barrier in seeking psychological help. 2/3 of people with mental illnesses don't feel the need for taking psychological help. Fear of being stigmatized has been established as the leading factor in avoiding professional psychological help around the world. Stigma is even more harmful than the actual mental illness. Stigma makes it difficult for people with mental disorders to get inclined for professional treatment. Stigma is generally typified into public or social stigma and self-stigma, and both these types are considered barriers in seeking psychological help. Stigma comprises of 5 elements that are labeling, stereotyping, separation, status loss, and discrimination. Stereotypes associated with mental illness further include dangerousness, incompetence, and character weakness. People mostly think that mental health services are meant for crazy people. Their negative attitudes towards people with mental problems are developed because of the psychiatric symptoms, social skills deficits, physical appearance, and labeling of the mentally disturbed. People who need psychological help avoid professional assistance for maintaining a positive self-image in the society and do not want to be thought as inferior, inadequate, or weak. People expect social rejection either before or after getting psychological help. Social stigmatization of people with mental disorders may also affect their families negatively. The relationship of the family with neighbors and relatives also become stigmatized. The effects and dimensions of stigma, however, may vary from culture to culture. In Chinese culture, for example, the intensity of stigma is quite high due to the family bonding. Chinese families tend to hide their members with mental disorders to save face in the community. In Egypt, people with mental problems are less blamed and more supported. For Indian families, the factors of family honor, shame and moral responsibility are significantly associated with mental problems, avoiding them to seek professional support. The stigmatized individuals have lesser chances to secure jobs, less likely to lease accommodation, and get intimate partners. Prior help-seeking experience has been positively associated with favorable attitudes towards seeking psychological help. There are studies, however, which have found that many mental health patients had bad experiences with mental health practitioners. Pakistan, being a developing country, lacks sufficient literature on mental health and its correlates. A study conducted by Dr. Sukoon involved 3,500 conveniently selected Pakistanis from different major cities such as Islamabad, Rawalpindi, Peshawar, Abbottabad, and Lahore. The respondents of the study mentioned 9 different barriers in seeking psychological help. These barriers in a descending order included no faith in psychological treatment, prior personal experience, religious fatalism, carelessness for mental disorders, social defame, personal shame, bad reputation of mental health practitioners, prohibition by family, and fear of treatment. To advance mental health practice in Pakistan, the respondents of the study also provided different suggestions for mental health practitioners. The respondents advised mental health practitioners to raise public awareness on mental health through seminars, workshops, public campaigns, and through electronic, print, and social media. The respondents, furthermore, advised mental health practitioners to improve mental health services by improving the quality of therapeutic techniques, offering free-of-cost therapeutic services, organizing recreational activities within the therapeutic process, increasing the number of clinics, separating psychiatric wards from hospitals, and offering psychodiagnostic services. Raising public awareness through media has also been suggested by earlier researchers. It could help in reducing stigma and shaping public attitudes towards psychotherapy. An overview of the Internet suggests that there are a very few psychotherapists in Pakistan who market themselves through personal websites and social media. The current study highly sensitizes the stakeholders, especially the mental health practitioners in the country, to initiate programs for raising public awareness on mental health. They should also narrow down the gap between religious beliefs and perceptions about psychotherapy. This can be achieved by developing indigenous psychodiagnostic tools and psychotherapies to address the culture-specific psychosocial issues. Initiating free-of-charge mental health services could also advance mental health practice in the country. Thanks for listening. To read the entire paper, kindly visit www.drsakoon.info.